Good afternoon, everyone. Thank you for having me. I am Carlos Leston. I am a pastor at Tabernacle Baptist Congregation. I work as an adjunct professor of counseling at Gordon Conwell Theological Seminary. I practice counseling for the last 10 years in a local counseling agency. My degrees are in marriage and family counseling and also in psychoanalysis, in society and culture, and in Christian education. The things that I heard today and what I read about this bill really ache my heart in my practice. I am here to represent the experience of a large minority group of people who have the right and liberty and justice and the pursuit of happiness just like every other American. What I heard today in my practice, if that's what I did, I would be long time incarcerated. Somebody will throw me away and then they will throw away the key, because that's not what we do in counseling. I don't know why we call it conversion, but that's not what we do. I teach and treat many different people of diverse social, cultural, and religious background. In the clinical room, I come across a number of people who exactly what is described today is their experience. They are suffering rejection, withdrawn, isolation, insecurity, issues of self-esteem that they suffer. They deal with the issue of confusion identity and gender identity. And as a result of that, it's not because this is exactly what they were, it's simply because they've been coerced by others to fit a social structure, to fit a group of people, or to find some sort of identity. And because of that, they feel so burdened by this reality, they damage significant relationship and experience serious mental distress. They come to counseling to seek relief from the complained distress, to come and seek relief, because that's what basically counseling is all about. Once they come to the office, we form a therapeutic relationship and we seek what we call the resistance to disclose information, break down the resistance, enable the client to face these painful realities in a way that they can handle it. We assure them of the importance of disclosing whatever they are dealing with. And also in this talking cue, we help the patient, the client, to explore what we call the unconscious and help them to deal with whatever issues they are dealing with in their private life, and also help them to manage the different issues that may contribute to a change in their personal life. Counseling is not only didactic, directive, but also person and goal oriented. The person's goal is what we pursue in therapy, not our own goal, but the person's goal. Should this bill really go into effect, it will seriously damage the goal and purpose of counseling, not only for us who work with different privileged people, but also the group that I work with, whom we are known in Massachusetts as the underprivileged. It will harm them. It will prevent them from receiving effective counseling as they should. And I think, ethically speaking, as the APA has defined clearly the guidelines that we're supposed to follow as counselors, if anybody is really practicing what I heard today, this person should be prosecuted. And I think this committee should just reconsider this bill, vote it down, and give us, the experts in this field, the opportunity to exercise our professional expertise to meet the needs of our clients. I think a lot of what is being said is more political than it is about the helping profession that we dearly uphold and give our life to really help others to be better in their life.
Thank you very much.